Hello, welcome to Be Well. Thanks for joining us today. I'm Jonathon Collopy from your YMCA. I'm honored to bring you these conversations with leaders in their field related to living mindfully. As your moderator, I come to you with 30 plus years experience in health, wellness, and mental health. I'm very excited to have this conversation today. It's timely relative to what's been going on in our communities. We're going to be talking about vaccinations, vaccines. It's an opportunity for us all to become well informed, educated. I encourage you throughout our conversation, use the chat function so we can do our best to meet your needs to get you the information that is relevant to you. And we're going to have a wonderful conversation and become informed in this area. I'm very honored to welcome Dr. Sayon. Dr. Sayon, thank you for joining us today.
My pleasure.
Dr. Sayon does a lot of work at the population level to address health-related issues. He's also sees patients in the county public health clinics. Dr. Sayon, if you just initially share a little bit about your background, which brings you to us today.
Thank you, Jonathan. And again, honored to be asked to be on this, interesting talk with you all and really spread the message about the facts and dispel any myths. So, and make sure people are informed as possible so they can make informed decision when it is their turn to be eligible for the vaccine. My background, I'm a board certified preventive medicine physician. I got trained in New York in terms of medical school and residency and everything. And then I worked in New York City Health Department for a few years before coming over to San Diego and becoming the deputy public health officer for the county under and directly working for Dr. Wooten. 2 years ago, I did shift roles, had a baby and start working in the clinics, et cetera. And then got pulled into the COVID Emergency Operations Center where I have multiple roles. Everything from taking call to the convention center to being on calls like this. So happy to be involved.
That's fantastic, and congratulations on your newest one. That's very exciting as well. So I know nothing about vaccines, so to speak, other than getting the flu shot and what I had to get as immunizations early on in life. How do vaccines work?
Yeah, vaccines are really one of modern era's both, and human technology's best inventions, right? There have been diseases for centuries that we don't even have to think about anymore. We don't have to deal with. We can read them in the history books, and we don't have to deal with in person because of the power of vaccines. And I have several slides, but I only will focus on them as needed, but I'll just share one, for example. But in general, before doing that, vaccines work in general, and they may use different mechanisms by getting your body primed to recognize the disease when it comes in real life by either giving some version of it, some weakened version of it, or in this case with the newer technology, which I can go into, really by producing a small protein, a harmless protein that your body eventually recognizes and learns to recognize well, so that it's ready for quote unquote war, in action when you see the real thing in real life. So, but I will just say that many of you may remember just a few years ago in our community, we had a devastating hepatitis A outbreak in our community, and you don't hear about that anymore. And the reason you don't hear about that is really that fizzled away as we got more individuals, and particularly those who are experiencing homelessness or using substances, vaccinated, right? We know that those particular communities were hit the hardest, and we don't see that anymore. So, and this is just real world data that was shown in a New York Times article that I love. And this shows that our most vulnerable community or sectors or areas arguably are nursing homes, right? These are often older adults who are medically vulnerable and need to be in this type of setting. And so where we have seen a lot of death and loss and premature deaths and dying and suffering. And so you see here that there's a red line that shows the deaths amongst nursing home residents, and then a gray line behind it that shows the overall US COVID deaths. And the wonderful news that you see here in January, you see that the line split in completely opposite direction. So as the US continued to increase in deaths, the nursing home deaths actually went down. And that's because they were first in line for the vaccines, arguably and appropriately so. And once they started getting the vaccines, then it was so powerful and protective that we see very minimal, deaths and disease in these settings. And so these are extremely effective and the best public health tools we have. They're the safest way to get immunity as well. And just to kind of sink in that point, this is data that I just pulled yesterday morning from the CDC's data tracking site, and it shows the cases of COVID in nursing home settings. And you see it is at an all-time low here, lower than it ever has been when they started tracking it. So, or in last year. So, and that's all thanks again to the vaccine. So
So
back to you.
that's a pretty dramatic representation in terms of the impact of vaccines. I would just share with you, I'm in awe that literally this is the 1 year anniversary of how our community has been impacted by the virus. And we already have employed 3 and probably many more vaccines coming. With that, there is a lot of education and miseducation out there in terms of the vaccines. First off, there's concern that these vaccines came out so quickly. How safe are they? And so I wonder what you could do to dispel some of the concerns around that.
And thank you, Jonathan. That's a very valid question. And for many of us, as humans and as right, it is totally natural to be concerned about something being made or produced at a record pace than ever before. And really, the shortest time span that we've seen for vaccine developments before this has been around 5 years. And so, as Dr. Fauci, I heard him on the news today, and he mentioned that really they started in January, and so within 11 months, there were at least 2 vaccines that were authorized by the FDA for emergency use. And I do have a slide on that I'll find soon. But I think a lot of this has to do with really the process and what was preserved in the process versus what was sped up. And so in the very beginning of the process, there's a lot of investments and kind of financial risk these companies take, et cetera. And a lot of that was minimized. A lot of the quote unquote bureaucratic red tape was minimized. And of course, the whole world knew that this was the way that we would get out of this pandemic globally. I don't think we really truly appreciated what the scale of the pandemic would be back in January of 2020, but they were thinking and in the right direction and totally appropriately. But even though they sped up that beginning part, and then at the end of it, there's an authorization process for emergency use. The middle part, which is the most important, and that is that they still went through all of the necessary phases and stages to get the approval the submit for emergency use authorization without cutting corners. And I'm gonna find, okay, here's the slide. So this picture, hopefully you can see it. Okay, do you see that? Oh, I'm sorry, I'm not sharing my screen. So this kind of depicts these phase 1, phase 2, phase 3. These are the clinical phases and studies, then the trials that have to be done. So first you make sure that it's safe, often in animal models before you go to humans. And then once you go to humans, you start off small. And then if you can verify that they're generally safe, and then you start expanding. And that's what they did. And they went through these trials. They had large amounts, I mean, thousands of people, around 40,000, 30 to 40,000 per trial or per company. And they went through all the appropriate steps to ensure that these are safe and effective. That said, of course, there were things that were not seen in the trials, and there were groups that were not in the trials, like pregnant women, or there were things that were not seen in the trials that did show up later, just in full transparency, such as severe allergic reactions. But the reason they didn't show up in the trials is because they are so rare, and they continue to thankfully be extremely rare. And because they are rare, and even though they are rare, it's good to know that they continue to be rare, but it's also really good to know and very reassuring to know that no one has died from the vaccine, since they've started to be distributed more globally. And then also the folks who get those reactions, there's a reason that the majority of them really qualify or have pre-existing reasons to be even more concerned, and we monitor and really across the whole US, that we're supposed to be monitoring individuals for 30 minutes instead of the usual standard 15 minutes if they have risk factors. So for example, if I have a known allergy to another drug or medication, then I would be monitored for longer if I'm at risk based on how I fill up my pre-checklist. And then in addition to that, all of our sites are well equipped to handle these extremely rare events and of course get folks appropriately into the hospital system if needed.
Dr. Sayon, this is very helpful. One question it brings up for me, I know Moderna and Pfizer, my assumption is they went through clinical trials earlier when the virus may not have had as many variants to it. And it sounded like Johnson and Johnson may have been going through clinical trials later. And so I just wonder the efficacy of the various vaccines that are out there and how you can guide us in terms of mediating that.
That is absolutely correct. That the timing, of course, matters. So if it's okay, I'm gonna slow. Okay, there it is. So this is the overall summary of the Pfizer and Moderna vaccine data in terms of effectiveness. And then when you go to Johnson and Johnson, this is a little slide I created, but you're right that, and certain people hear that the difference in effectiveness or efficacy is 72% overall in the US, which is different than the 94, 95% that we might have been used to be hearing earlier, right? And so first, please remember that the reason that these vaccines have come to market right now is because these are new technologies. Even though they've been studied for decades, they're newly applied, and for human vaccines. And so, but it's amazing that we have the technology to be able to do this so quickly. But of course, they're doing this safely. And I didn't mention earlier, I forgot to mention that in addition to the usual kind of clinical trials, there's even more post marketing or post trial surveillance than there has been ever. In fact, they even have something called V-Safe, where after you get your vaccine, you register for this and it texts you every day for a few days, and then even once a week. For example, I got my 6-week post-vaccine text, just checking in on me, seeing how there's, and CDC actively monitors that data, and they update those data very frequently, and they have teams that look at that on a monthly basis or so, and every time they get together for these larger meetings. So and it continues to be that the safety data remains. There's nothing really unique out there, that wasn't already shown in the trials, or these severe allergic reactions that continue to be rare. For now, going back to your question, for Johnson and Johnson or Janssen, the reason you might hear these two different names is because Janssen Pharmaceuticals is the pharmaceutical arm of this huge mega corporation, Johnson and Johnson, that makes many other things that we are well familiar with. And just to go over Johnson & Johnson, you're absolutely correct that the trials were done, and you can't compare the numbers, and it's really apples to oranges because they were done in different times and settings. And so you're 100% correct again about right, these variants of public health concern. We first started identifying them around November as a global, public health community, and these trials were going on. So this is the first trial data that includes variant level data. And this trial specifically had arms or trials done, or parts of the trials done in South Africa, in Brazil, where we know that the variants were largely the dominant variants or strains that were circulating at that time. And so it's actually very reassuring that even in South Africa, they had 64% effectiveness. And effectiveness really is just talking about getting any kind of symptomatic COVID. But really, what's most important is arguably not even to look at the effectiveness, but to also, or just as importantly, and if not more importantly, in my opinion, to look at the effectiveness against severe COVID. And so, right, the reason we have all of these, interventions, these restrictions, the reasons we're not, having what's called a normal, things are not normal as they were 2 years ago, right, is because of the severe effects of COVID-19, right? It causes many people to get hospitalized, to pass away, unlike, many other diseases. It's not, much more, for example, than flu, et cetera. It's a brand new disease, so we don't have immunity to it yet. With the vaccine, all of the vaccines to date, even the ones that haven't submitted for FDA emergency use authorization, when you look at their data so far, they all are extremely effective against a severe COVID-19. And this one was particularly effective. It's 83.5% effective in the US, but 100% effective when you look at hospitalizations and preventing hospitalizations and COVID-19 deaths. There were 0 hospitalizations and COVID-19 deaths in the trials overall, and even in South Africa and Brazil. So I want to share with you that that's extremely important, because these took place in places with the variants, and some of the variants have some data suggesting they may be even more deadly than the current strains.
Dr. Sayon, that last comment was very moving for me, in the sense that I know Dr. Fauci has said that we should all get vaccinated as soon as possible. And then I often thought, well, there's 3 different vaccines out there. Initially, I was thinking I didn't want the Johnson and Johnson, and if I had the option, I'd go with the other 2 because the efficacy was much higher. But hearing that last point in terms of Johnson and Johnson's effectiveness in terms of severe hospitalizations, possible death, and guarding against that, I was moved in that direction. And so it seems like any of the 3 right now is going to be very effective.
Absolutely, right. The quickest way to get back to normal as a society, right, if you will, is really building that immunity across the society. So any of these 3 vaccines are the way to do it. And the CDC and FDA kind of call them equivalent vaccines. And we're doing that as a county, right? When we got Johnson & Johnson earlier this week, we're just putting it into our plan, like the other vaccines. So currently, just because of very limited vaccines, there's no ability to allow folks that choice, but that will change in the future, of course, as there's more vaccines available. But so I always say, what you see probably on the top of this slide is that the best vaccine for you is the one that is first available when it is your turn to get the vaccine. And I love this quote, in case anyone wants to read it, but this is a prestigious physician who talked about, so you may have a mild runny nose or mild upper respiratory tract infection, but you're not going to develop a life-threatening pneumonia or require hospitalization or be intubated, and they would get Johnson & Johnson any day.
That's compelling. So I've heard that there's a lot of information out there in terms of different side effects. I've heard that one sex over another might be impacted more, male versus female, in terms of some of the side effects. What can someone anticipate as potential side effects? I know not necessarily the severe ones, but really the most common side effects.
Yeah, there's a lot to anticipate, and trying to change this slide, but there are definitely things, and these are, I know they're called side effects officially, but I like to call them expected effects, because really we know that that many of these will happen, and it's safe to assume that many of them will happen. The older you are, the good news is that the less likely you are to experience side effects. So it's right here. So, the majority of people will experience some local side effects or expected effects, and this is the pain and swelling in the site of the injection. Some people, then some to many people, depending on, again, age especially, may experience more of these what's called systemic side effects, and that's the fever, chills, tiredness, and headache, right? And typically they get better after 2 or 3 days. If they do not, of course, please contact your provider, get medical attention. The thing to be concerned about, or informed about at least, really, is that there are side effects, that are clearly due to the vaccine, and then there are there are symptoms that are clearly due to coronavirus disease, and then there are overlapping effects or symptoms that could be due to either. And we still have a lot of COVID in our community, right? We're still in the purple tier for that reason, because we have a high case rate. And so it is important just to acknowledge that, right, it takes about 2 weeks from the last vaccine to be fully protected from that vaccine. So until then, you still have to be very, very mindful, that you could also get COVID-19, not from the vaccine, but just from your general day-to-day exposures. So I just wanted to highlight that here.
To stay with that last point for a moment. So let's say I got the vaccine and then I started to have symptoms that seemed to be more COVID-19.
Yeah.
That initial dose of the vaccine, would it knock it down to some degree, or does it take a certain duration for the full experience of immunity? I understand would be the second dose and then some. But if I've had one dose and then I'm having these symptoms, how does that complicate being able to get full vaccination?
Right. Yeah, and one dose of the two mRNA vaccines that require two doses will still give you a lot of protection, quite a lot actually. But it still takes about 2 weeks for that process to go to work in your body, where your body recognizes it, builds antibodies, and really primes that rest of that immune system to be prepared to fight off COVID. So if you got your first dose and then you get COVID symptoms a few days later, and I'm talking about, and there are things that are unique. And just to look at the slide right there, um, shortness of breath, cough, runny nose, sore throat, loss of taste or smell, that has nothing to do with the vaccine. So if you have those symptoms, those are some of the classic COVID symptoms, then please get evaluated by your medical professional, or come to one of our sites and get a COVID test, because you could get COVID. Just statistically, it does happen where some people get it a few days after the vaccine because it's around in our community. But if you have one of the overlapping symptoms like fevers and chills, and you're within the first few days, still talk to your medical provider. And if it doesn't go away, especially, or if you know that you were recently exposed or something like that.
So once I've been fully vaccinated, is there a particular duration that that immunity provides for?
That there is, but it's not fully known yet how long that duration is. I mean, CDC definitely says that they definitely understand that it's at least 3 months. The understanding and some of the medical literature is really supporting many months to possibly years, and really we're seeing really strong reactions and immunity that's lasting. And I will just want to remind you all, if you haven't already heard, that all three of the trials showed that immunity impactful across, when you generally speaking, races and age. There's really no biological reason to be concerned about races and ethnicities having different responses, but especially for age, a lot of people are concerned and thinking, okay, well, older people have weaker immune system, maybe they won't have as good of a response. But that was not shown in these trials. Generally speaking, there are some maybe smaller data age groups where they want to continue monitoring, but that's generally the case. And because of that, I just wanted to say that we need to be vigilant, and the CDC, of course, is continuing to look at that data, and they will expand. And just because we're so close to when this pandemic started, we don't know exactly how long, but some of the modeling and projections seem to appear that they may be longer. But it could be also a reality that we may need booster shots or things, especially with some of these new variants, if they impact the vaccine or the effectiveness of the vaccine. So time will tell.
So I know more recently there's information coming about after you've been vaccinated, what you can and can't do, and in what time frame. So one of the most important questions that comes through is, are we able to can we spread the virus after we've been vaccinated?
That's an excellent question. I think that there's building data, so it's still a question, little bit of a question mark for CDC, FDA, really the world right now, but because none of the trials were set up to necessarily answer that question. The first question you want to answer is, does it prevent illness, right? But then the second question after that is, of course, does it prevent spreading asymptomatic disease, meaning if you get the vaccine, can you still be a silent spreader? And if you can, then of course we have to take a different route in terms of what we can allow and what we can't, versus if it does not. Right. So because of these reasons, thankfully, there has been accumulating data. When you look at some of these trials, at least the follow-up data or some of the sub-analyses for trials like the Moderna one, the Johnson & Johnson actually really contributed to that data with their studies, really supporting, again, that that vaccines are likely to prevent transmission. Meaning, if I got vaccinated, I cannot be a silent spreader. Because of that accumulating data, CDC literally has a science brief that supports their recent guidance that they issued Monday, and they acknowledge that because that building data, as well as the data about vaccines being extremely effective at preventing severe COVID, and of course other data to support vaccines in general, that the CDC is now comfortable with small gatherings, meaning vaccinated people hanging out with another vaccinated household with no restrictions, indoors, no masks, kind of back to quote unquote normal. And the other scenario that they are also okay with, again, in very small settings, is one vaccinated household hanging out with a non-vaccinated household only if that non-vaccinated household is not at risk for severe COVID.
Mm.
And I have a
You,
picture, so I'll pull that up too. Sorry.
you raised the question earlier about the vaccination, whether it's safe or not for those that are pregnant as well as children.
Yes. Um, I I definitely, so for pregnant women, and if you don't mind, Jonathan, can I just to cement the points from last time, can I just go over this real quick?
Please,
Sorry. Okay,
please,
so
thank you.
this is the image that accompanied the CDC guidance page on the new kind of permissions, things that are permissible for fully vaccinated individuals. And
Yeah.
so this is what I was saying earlier. They can hang out with another household. They can also hang out with another household. This is the orange, which is unvaccinated, but at low risk for severe COVID.
I'm not,
Um,
Doctor, I'm sorry, I'm not seeing
of
your
course.
screen. I think we need
Oh,
to.
I'm so sorry.
Okay, thank you.
Yeah. Okay, there you go. Sorry, you can see
Uh,
that. So this is for fully vaccinated individuals to hang out together. This is for fully vaccinated individuals in one household to hang out with a unvaccinated household, as long as they are low risk individuals. So think of this as grandparents maybe hanging out with their kids and grandkids, as long as none of them are high risk for severe COVID. Once you get into other scenarios, like hanging out with folks who are at higher risk, then the CDC really recommends you take that outside, you wear your masks, you distance, etc., just to minimize those chances. Okay. Now, going back to your question about the pregnant women and children, you're right. So the pregnant woman, even though the trials all had many people with underlying conditions, even some who had COVID-19 in the past, they did not allow for pregnant women, because you want, the most vulnerable folks are usually your youngest individuals in society, and then the folks who are not even born, right, the fetuses, who are in, and the pregnant women. And so because of that, they typically exclude them from the beginning trials, and then after the initial large scale trials show that they're safe and effective, or reinforce that they're safe and effective, then they expand their trials to include these other groups. And so that's exactly what's happening. So even though no pregnant women were in the trials, they actually looked at the data just 2 weeks ago when the CDC met. I think it was the March 1st or something like that. And they apparently, even though none of them were in the trials, there were over 30,000 pregnant women who have gotten the vaccines since, just because, for example, some may be healthcare workers who were eligible, and they're at high risk of exposure because of who they work with and the settings, and they're at high risk for severe COVID because they are pregnant. So it's their individual choice. They need to, of course, they should be advised to talk to their providers and make that risk benefit calculation. But the CDC looked at that data, and they specifically put all these over 30,000 individuals, pregnant women, into a registry. They looked at their data separately, and there was nothing that showed that their side effects, et cetera, was any different than others. And there was nothing to indicate that there was any higher rates of, for example, miscarriages or anything related to the pregnancy, or the fetus and their health. So far the data is looking good. But that said, there are doing trials. I know Pfizer has started trials for pregnant women specifically. For
right.
children, same thing. Pfizer, Moderna have started with trials. You first start with the age groups that are closest to the age groups already proven to be safe. So it's kind of like 12 to 15 for Pfizer, or 12 to 18 or 17, sorry, for Moderna. And then after that is shown to be safe and effective, then they will do trials on even younger individuals.
There was a question, Dr. Say, on whether the vaccine would affect or alter DNA.
No, it cannot scientifically alter DNA. And that's because both, whether it's the messenger RNA, right, it's just RNA. It does not even enter the nucleus or wherever the DNA is and works outside of there, doesn't even come close to it. And then, so that it doesn't happen. And then two, for the Johnson Johnson, it carries a small bit of DNA into your nucleus, but it doesn't really interact with your DNA, it just uses that machinery to create messenger RNA, which then goes outside the nucleus and create that harmless protein that your body learns to recognize.
Thank you for clarifying that. Will a recipient of the vaccine test positive for COVID on a viral test after having been vaccinated?
Not due to the vaccine.
Okay.
So the vaccine cannot make you or will not make you test positive for COVID-19 testing, because all the vaccine is doing is just introducing that harmless protein into your body that your body learns to recognize. It does not give you COVID or anything like that. It cannot, by definition. But like I said earlier, just because there is a lot of COVID activity still in the community, it is possible by chance that someone got a vaccine and also was exposed recently and then comes down and gets infected to COVID, but it cannot scientifically occur because of the vaccine.
Excellent. The Moderna and the Pfizer, which are 2 doses, if I'm getting vaccinated, do I have to have both doses from the same manufacturer?
Yes, the CDC is saying yes because that's how the trials were done, right? There's no studies showing kind of a mixed dose trial or regimen, and so until that's the case, then they have to officially say yes. And of course, every attempt should be made to stay and stick with that same brand for that reason, right? For safety and effectiveness reasons. Of course, if unfortunately for whatever reason you get the other dose or the other type of vaccine, the CDC does say if something inadvertently happens, then it's okay. You do not need a third dose or anything like that.
Excellent. My assumption is there's probably more vaccines being brought to bear. Are you aware of?
Yeah, they are. Absolutely. There's even vaccines, for example, that are already approved and used in Europe, like AstraZeneca's vaccine or Oxford's vaccine. And so there are a lot of vaccines in the pipeline. There are certain websites like the New York Times that have vaccine trackers that show you how many are in each phase of the pipeline. And so this is all good news. This is, the more the merrier. It's kind of like the flu shots. There's several different brands. And regardless of which brand you get, they all achieve the same goal. And the more and the quicker we as a society get to levels that we determine to be herd immunity, right, the quicker we will continue to see what we're already seeing, which is that decline in cases and declining in hospitalizations and deaths, which is most important.
So I'm aware that there's certain populations or demographics that are choosing not to get vaccinated. And I'm wondering how we overcome that. I think part of it's providing education. Is there something that we haven't said or talked about that would be important to bring through?
Yeah, thank you, Jonathan. I do think that there are many reasons, of course, folks are hesitant, if you will, to accept the vaccine when it is their turn, and these could be some historical reasons for society and treatment or mistreatment in the from the medical community, and there could be other reasons, right? And I do think, like what you're saying, conversations like this in meetings and coming to you and several of us coming to you to have these conversations and use facts and spread the facts are very helpful for folks to make those informed decisions. We have the ability for, if anyone's listening who works for um, or as part of a different group, whether it's a community group or their workplace group, we have the ability to offer community conversations, we call them. And so you can ask for a presentation, and one of us really will be more than happy to offer that. I will say, in terms of one thing that I think in terms of hesitancy, there was a couple of things that I've heard a lot in terms of what people are thinking. One is that kind of alter your DNA. Two is what you already spoke about, is these are so brand new, and they rushed, they were quote unquote rushed, or they came to market so quickly. How is that possible? Something must be wrong. We are several months into this vaccine response now, right? So they first became kind of available outside the trials in December, and it's March. And so, there's nothing that is different. There's no new things that we're discovering really, and no reasons to be additionally concerned. And we have now an additional third tool to help us. And as you see, the CDC is even saying, and in some ways, I think, helping to change that culture and incentivize us to get fully vaccinated, because when you're fully vaccinated, you can have a little bit of normalcy. You can hang out with another vaccinated household, right, without your masks, and feel comfortable about that and not worry about getting or spreading COVID-19, right? So there are things like that I think as people understand and appreciate more, people will hopefully accept vaccines at higher rates. The other big thing that I tend to see a lot or hear about a lot is there are a lot of younger individuals who feel invincible, and I did when I was in college, for example, right? And couple things to know is that the highest case rates, those when you look at who is infected with COVID by age group, actually it's the 20 to 30-year-olds who had the most cases, and have the highest case rates as an age group. And then after that, of course, the 30 to 40 or 39-year-olds. And even though they are not getting hospitalized or dying at the same rates as, for example, folks over 60, there is a lot of suffering in there. And many people don't realize that there are these long-term effects of COVID-19, like continued loss of taste and smell that maybe doesn't get enough attention or something like that, or people get knocked out. I mean, one of my best friends growing up, he's in New York City. He got COVID-19, and he was pretty bad, but he was suffering at home. He did not get hospitalized, but he's just, wish he hadn't gotten it. And so it's interesting to hear from him, and he's a very young, healthy guy. The other thing is that so a lot of people think, hey, I'm young, I'm good, I'm not going to get hospitalized or die, but so I'll just roll the dice. I don't need to get the vaccine. But vaccines are the safest way and the most effective way to gain that immunity. And we know that. And then you're not only protecting yourself, you're really protecting your community at large and helping really the economy recover and us all get back to normalcy quicker if you are accepting that vaccine.
That's heartening to hear, where we can gather with our friends and family sooner versus later. Dr. Seon, any particular resources that we'd want to make available to the community?
Yes, there's sure many resources. I know one good place to do kind of all-stop shopping, one-stop shopping, is our website, is coronavirus-sd.com. And so we have not only plenty of information on the vaccines, we also have plenty of information where you can find the vaccines, how you can there's a map there, and where you can locate our sites or our partner sites. And then we actually even just stood up another page about additional partners who are offering vaccines, as well as we have information about testing, right? If you have symptoms that are COVID symptoms, please remember, even though we talk about vaccines all the time now, it's still important to get tested if you have COVID symptoms, because we need to understand who has the disease and then try to do whatever we can to prevent the further spread.
Dr. Seon, a pleasure to have this conversation with you. I appreciate truly all that you're doing in supporting our community at this time. So thank you very much for joining us today. Really enjoyed our conversation and the education that you're bringing through.
Thank you so much, Jonathan.
So you be well, and all that joined us for today, thank you very much. There's resources out there available, and if there's questions, feel free to reach back to us at the Y. And until our next time together, please be well. Thank you.